The new Delta variant is causing COVID cases to creep up across New York City, prompting calls for a renewed mask mandate from local leaders and health experts.
The vaccines help immensely, but if you're indoors, especially around people that you don't know, so in public places, stores, public transportation, other gatherings, I would still consider masking, especially as this variant is spreading. Once more people are vaccinated, then we may be able to scale back again.
However, Mayor Bill de Blasio and the health commissioner say another mask mandate is not the answer. So joining us this morning to discuss why New York needs a new mask mandate is City Councilman Mark Levine, who also serves as the chair of the council's health committee. So good morning to you, Mr. Levine. Thanks for being here.
Thank you, Dan and Vanessa. Great to see you.
Great to see you as well. So this is a big talker this morning, right? We're seeing the number of positive COVID cases inch up slowly. Where a couple weeks ago, they hovered between 200, 300 new cases a day. So the latest stats, sir, from the New York City Department of Health show that in recent days, the number of positive cases surpassed 1,000. Now, that's a big number. So is the answer to bring back the masks, to double down on vaccines?
Yes, cases have now tripled in the last 14 days, and hospitalizations are starting to inch up just in the last couple of days. So we do have to take action. Vaccination is our best tool. And to anyone watching who has not yet gotten their vaccine, know that this is an increasingly dangerous time to go without that protection. But in stores, in subway cars, in movie theaters now, we have a decrease in the use of masks in New York City. I think many of your viewers see it when you're out there. And that exposes kids to risk because they can't get vaccinated, people who are immunocompromised, even workers in those venues. And we need to act now to lessen the risk for them and to slow the spread. And the return of masks is one important tool that we can use to achieve that goal.
Right. So, Councilman, Far Rockaway, Queens, and parts of Staten Island have the most numbers of unvaccinated residents so far. You mentioned that obviously vaccines is our best point of defense. Obviously, bringing the mask mandate also on the table. Is there anything else that can be done, right, to remedy this? Because messaging has obviously ramped up. Is there anything that needs to be filled, any void that you can fill with trying to get the word out to get folks vaccinated?
Well, on messaging, I worry that with all the celebrations, which are warranted of the reopening and having a summer, which is something like normal, that a lot of folks aren't aware that COVID-19 remains a threat, especially if you're unvaccinated.
Yeah.
And that folks have let their guard down and are no longer seeking vaccines in significant numbers. So I think we need to both communicate the excitement and joy of reopening with a note of caution that if you're unvaccinated, this still is dangerous.
So,
and please.
So the mayor actually, I just want to say, he said that if you were vaccinated, you don't have to wear a mask, right? Because that you should be able to celebrate that you did the right thing. For the entire course of the pandemic, we heard that you wore a mask to protect others in case you had the virus. If I'm vaccinated, why do you think I need to wear the mask? And does it prevent those who are unvaccinated from getting the vaccine?
Well, first, if you are vaccinated, you are much better protected than those who are unvaccinated, but there's still a very small chance that you can contract the virus and potentially spread it. The science on that is less clear. But there's a second reason, Dan, which is that you really need mass solidarity. If you have an honor system like we have now, pretty soon no one wears their mask. It's just hard to know who's vaccinated. Store staff can't manage that. We need to have a return to mass solidarity so that all of us in sensitive settings like subway cars, like supermarkets, all of us are wearing the mask. It becomes part of the culture, and that protects everybody, especially those who are vulnerable, kids, people who are immunocompromised. It's a better system that we need now as cases are rising fast, and sadly, hospitalizations appear to be increasing now too.
Very delicate balance here, Councilman. So Restaurant Week, we know, just kicked off. A lot of people excited about that. Tourism is on the rise. Reintroducing a mask mandate, as you know, could really harm these businesses that are just trying to get back on their feet. How do you respond to that?
Well, I actually think restaurants are a special case. Of course, you can't wear your mask while you're eating or drinking. I am more concerned about venues like movie theaters, delis, stores, etc., where there's really no reason you can't wear your mask, and we're seeing mask use decline in those settings. So I am trying to strike the right balance here to continue our recovery and protect the vulnerable and try and blunt what looks to be like another oncoming COVID-19 wave in New York City.
Yeah, I mean, and people are seriously worried about the Delta variant, right? California and casinos in Las Vegas, they reinstated mask mandates because they are seeing such a rise in cases. But I want to get back to a question I asked because I'm not sure of what the answer is here. If you are unvaccinated and you haven't gotten it yet, isn't the likelihood right now that people are saying, I'm not getting it? Right? And so now you're telling them to put their masks back on. Is that preventing them from going to get the vaccine? Should the focus actually be on educating people who are unvaccinated to go get the vaccine who are hesitant?
Oh, absolutely. We have to continue to reach out to people in their communities with trusted local leaders, going door to door. We need to do even more of that for sure. And we need to tell people the vaccines are incredibly effective and safe, and that if you have been vaccinated, your chances of getting serious COVID, of landing in the hospital, or heaven forbid dying are much, much, much less. But we still have the problem of public venues where you have some people who are vaccinated and some are not, and a decreasing number of people wearing their masks at a time when COVID's on the rise. Over 500 new cases daily in New York City.
We're out of
time here. We have to do
here.
something about that.
We're out of time, Councilman. Real quick, do you see a lockdown or businesses closing as a solution moving forward?
I don't think so. Because of the number of people who are vaccinated, our city is so much better protected than we were in the spring and the fall of last year. This is just about tweaking policy to keep the vulnerable safe at this moment.
Understood. Councilman Levine, appreciate you joining us this morning. By the way, congratulations on Manhattan Borough President nomination as well.
Oh, thank you, Dan. Very, very excited about that.